Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Now, NHS services across England could be cut as part of wide-ranging efficiency plans seen by the BBC. The proposals include ward closures in some areas, cuts to bed numbers and changes to accident and emergency departments. NHS England needs to save £22 billion by the end of 2020 and says local people will be consulted on the plans. Well, our health editor Hugh Pym is in Leeds for us tonight. Hugh.
Yes, Clive, here in West Yorkshire and in communities around England, a lot of debate's been going on about how the NHS might look like in the future. Now, it's been going on under the radar until now, but it really seems to add up to something very significant. NHS managers say it's simply about making better use of NHS money at a time of increasing pressures. But local campaigners say it's really a licence to make cuts, which will inevitably affect patients and services. It's a process which could result in a radical shake-up of health and social care services in some areas of England, with possible closures of A&E units, hospital buildings and a review of GP services.
Well, it looks like quite a lot of these plans at the moment are proposing big, large-scale reconfigurations. That's shifting services or shutting services down, providing them elsewhere.
Here in Leeds, plans have been drawn up for the possible closure of some wards across several hospital sites in the city.
Government officials who have their hand in the NHS pockets, they should get the cuts, not the doctors, nurses, patients, everyone who uses and works on the NHS on the front lines.
The population's growing, so how can you make cuts when there's more demand?
In nearby Huddersfield, the local A&E is already earmarked for closure.
The view is that care will suffer.
Campaigners who've been fighting that decision are concerned by the latest news of a wider local reorganisation.
Everything seems to be done piecemeal, and there doesn't seem to be an overarching plan that puts patients and the public at the centre. I think there needs to be a huge debate about the NHS.
Other plans include Leicester, Leicestershire and Rutland, with proposals to reduce 3 general hospitals to 2, the Black Country area of the West Midlands with a plan to close an A&E unit, and in Cornwall there's a plan to move resources from hospital care into the community. Here in West Yorkshire and around the country, the word from NHS England is that local health and council leaders will work together to decide the best use of resources to meet the increasing demand for patient care. The background to all this is the need for efficiency savings to help make the NHS's finances add up. NHS leaders say it's not about cuts for the sake of it, but how to meet the needs of a growing and ageing population.
With that demand comes rising costs, and we're not trying to say, well, the simple answer is to just slash and burn and close services, but in fact we need to think about how we deliver services and what tends to drive up those costs.
And then Claudine, just 30.
NHS England says no plans have been finalised. When they're published in October, there will be a chance for local people to have their say. Judging by today's exchanges, stand by for a heated debate about the future shape of the NHS. Now, if you talk to senior people at the top of NHS England, they say this is a really important process for the NHS. They have to find these £22 billion of annual efficiency savings by 2020, and this exercise is what that's all about, finding how to make the money go further. But it's going to be a hard sell. Local patient groups and others will undoubtedly oppose closures in their local areas, and some will be arguing tonight, I think, that what the NHS really needs is more money.
OK, Hugh, thanks for that. Hugh Pym there, live in Leeds.
There's been an axe hanging over the NHS in England since last October, when the Health Service was told it would have to find £22 billion in efficiency savings. Well, today we began to see where that axe might fall. Local NHS providers were asked to identify which of their services were unsustainable and perhaps should be centralised. That list was meant to be kept under wraps until October, but it was revealed today, shocking those who suddenly found that their local wards, A&Es, even entire hospitals might close.
The warning lights are flashing in England's NHS, a service having to save £22 billion in 5 years, while dealing with chronic staff shortages. Leaked plans reveal that savings means closures.
We found evidence across England of plans to cut, change and in some cases close frontline services, so things like GP surgeries, like A&Es and like hospital beds.
But is it fair to say that a lot of these plans are hypothetical to a certain extent? Therefore, they're doomsday scenarios, aren't they?
This is not a piece of ideological research. This is a really comprehensive audit done by health experts.
The leaked plans suggest that in northwest London a £1 billion shortfall would mean cutting 500 beds. In Leeds, 5 wards would be at risk of closing. And the number of acute hospitals in Leicester would be reduced from 3 to 2.
Leicester is very unusual if you look at a city of that size and still having 3 hospital sites that run. That's not very efficient in terms of workforce and staffing rotas across those sites.
So the sense that these plans are more than just draft ideas, despite the Department of Health insisting nothing is final. At this central London hospital, the savings would be made by closing down the A&E department. And it's the suggestion of cuts to frontline services which only underlines the urgent nature of the political drive to ease the funding crisis in the NHS. Earlier this week, ITV News revealed that 16 trusts in England had been forced to close or suspend essential services because of staffing problems during the last year.
There's a real risk that pressures that the NHS face will get greater, that services could cut, and that patients will find it harder to get an appointment with their GP or to get an appointment at the hospital.
And even if NHS managers hit the target of £22 billion in savings, will it be enough?
At the end of the 5-year period covered by these plans, the NHS will face on a year-by-year basis a new funding gap emerging as the population continues to age and new medical treatments are invented that we have to offer to patients.
Labour and other opponents of the government's NHS policies argue that any funding crisis is caused by political choice.
And it is intensely political. First, what are Labour saying about it tonight?
Well, I was listening to Jeremy Corbyn outlining his NHS policies this week. He talked about the NHS being starved, robbed, in deep crisis. He blames the private deals that have been signed. He says we're spending £2 billion a year on these private deals. He says the private sector is milking the NHS. He would increase corporation tax, he says, to produce more funding for the NHS. So really blaming the costs of agency staff as well and the private sector, and insisting this is a Conservative plan to dismantle the NHS and bring the private sector in to fill the gaps.
Look, Theresa May back from holiday now. Is this going to prove as big a headache for her as it did for David Cameron?
It's a headache for other prime ministers too. I mean, Gordon Brown, Tony Blair, for example, they've all been dealing with this simply because every year the NHS has to do 3% more than the year before. We're all living longer, there are more of us. Those are the facts. It doesn't really matter which political party is in power. It's simply the facts of population growth are pushing the cost. The demand is outstripping supply, if you like. So, you know, Theresa May has to come back and immediately, Jeremy Hunt, the Health Secretary, he's due to sign off on all these draft proposals in October. There's got to be consultation. This will be in her in tray. This is something she's going to have to deal with immediately. And you can sense the urgency around this. If the proposals, as we've seen them today, come into fruition, actually become reality, those are real cuts to frontline services. And remember, Theresa May in Downing Street said that she would help the struggling. And the NHS services talked about A&E departments, etc. I mean, they are the ones which really help the struggling in our society, the elderly, children and people who are chronically ill.
Angus, thank you.